CSA, I'm back. This is Miss Love TV. We are here now in the CSA Medical Aesthetic po sa kay Dr. Contessa Salvador, Alapag. By the way, our concern for today sa mga fine lines natin, gagawin ni Doc sa atin ngayon at sa akin po ay isang pong face thread lifting. Right? So, even though malayo, pinagtsatsagaan po man talaga namin puntahan at dayuhin po ang ating CSA po. Dito po kasi ay hiyang at alam natin na totoong doktor ang pinupuntahan natin.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we will demonstrate a so-called coglifting effect or coglifting threads on the lower face. Let's all welcome back Miss Lovely. Hi Lovely.
Hello Doc, thank you, welcome back.
Yes, so Lovely here still looks very good, okay? And in the past, we have done the so-called thread lifting for the upper third of the face, and I was looking at her forehead. It has still a very good firmness, and it's still rejuvenated, right? Okay, so for today, the concern is this mid-face area as well as the lower third of the face. So we wanted to lift the nasolabial fold and also marionette line, and of course lift the jowl region and have a very good jawline here, good jawline definition. Okay, so that's the goal, Ma'am Lovely.
Yeah,
right?
Yeah.
Also, for how are you during those last times that we have done the
I think it's
rejuvenation?
1 year already, Doc.
Yeah, it's been
so
a
far,
year. Yeah,
it's okay. Look at my eyebrows.
still looking natural. And the wonderful thing is we wanted to maintain that good eyebrow shape, eyebrow position. And Ma'am Lovely has beautiful eyes, diba? The so-called enchanting eyes. Okay, so of course she will be doing treatments that will really maintain a younger look. And for today, so we will be working on this region, the face area, mid-face and lower face. So we wanted to have that lifting effect. Actually, she still has a very good volume. Right now, we just wanted those volume to reposition them from the lower part of the face because of the pull of gravity, the aging, okay?
Yeah,
so those saggy tissues, we will just reposition them at the higher part of our, like for example, the zygoma section here. So we will be doing a non-surgical procedure again since Lovely here already had tried our PDO cog threads. We will be applying cog threads again on the mid-face and the lower part of the face. Are you excited, Lovely?
Yes, Doc.
Yeah. Do you have any concern before doing any procedure?
I think it's your magic hands, you can do that.
Thank you, and Lovely is so really nice in trusting our centers. Of course, we wanted to do a procedure that will be first and foremost very safe and product materials that were clinically studied, and of course a very optimal outcome, meaning to say we see results, right, Lovely?
Okay, Doc, thank you.
Okay, so I'm excited with the treatment that we're gonna do for Lovely for today. We'll show that procedure when CSA Medical Aesthetics return. And we're back, mga ka-CSA. So we will demonstrate a cog face thread lifting for Lovely. Okay, so our goal is to bring back the nasolabial fold to the upper position here as well as the marionette fold to the higher position, because you know the tissue volumes over time, because of the aging process and the pull of gravity, they go down, or we call it the descent of the tissues. And with Lovely here, we wanted to lift it going towards the temple region and also the zygoma region, okay? And before doing the procedure, of course, we have to do assessment and also our markings, okay? Whenever I do my cog lifting mid-face and lower face, I still make a boundary lines here. I start with the line from the corner of the mouth to the earlobe down there, and then the second boundary line will be from the lateral canthus and then intersecting that line to our first line. And then if we wanted to lift the nasolabial fold here, our entry point will be on the zygoma region here, the superior border, because we have a very good anchoring point here. And if I wanted to leave the marionette line here, it's gonna be anterior to the tragus, this portion here. So for my nasolabial, I can do like a fanning technique again here. So 3 strands of my cog threads there. And for the marionette lift, I can make use of 3 to 5 strands. Okay, the case-to-case basis. Okay, and we also wanted to pull the jowls here and improve the jawline here. We can have a higher lifting on the temple aspect, entry point here, and this side here we can have a vertical vector. So I am going to the first boundary line as my end point, so I can make use of 3 strands there. So technique wise, okay, before injecting we have to disinfect the area. Actually, before we have started doing this, we did anesthesia or applied topical numbing cream, and then we need to clean the area again. So the kinds of threads that we will be using will be the so-called spiral cog threads. Okay, so we'll clean again the area. So a while ago we already applied topical numbing cream. We left it for about 45 minutes, even up to an hour, to really numb the skin area. And I can still make use of my pain freeze to have more numbing. Of course, we wanted to reduce any pain or control any pain. And this one is skin coolant, like an anesthetics also. And I'll be injecting my lidocaine at my entry point. So if I will lift the nasolabial, so I will be on the superior border of my zygomatic arch. So this will serve as my entry point. And then I can further numb the mid-face area via doing the so-called infraorbital nerve block. So we can spray the pain freeze again. So Ma'am Lovely here will not feel those cog insertions. So this is to numb the mid-face section here. So I'm doing the so-called infraorbital nerve block there. So we'll be using spiral cog threads here. Okay, the kinds of cog threads that we are using right now are the so-called multiple bidirectional cog threads, meaning to say there are several bidirectional strands there, and they give you a better grasping of the tissues and a stronger hold. So for my entry point there, so I'll make use of my gauge 19 needle for my entry point puncturing. Okay, there you go. And then I have a spiral cog thread here. It's like a gauge 21 with 100 millimeter length, or it's like a 10 centimeter length. And then this will be our entry point, and then we'll go towards our nasolabial fold there, and we'll just glide towards the fold. Already near the inferior nasolabial line, so I'll just be like half cm lateral to that and press and then pull out. So now the remaining strands, okay, we can pull a bit and cut the remaining strands and press onto the skin and cut. So there you go. So this is the nasolabial fold lifting technique. Now if we wanted also to correct the marionette line there, so our entry point will be anterior to our tragus. So my pain freeze again. So there's a frosting. Okay, this one will help in reducing any pain, because as much as possible we wanted to help our clients feel comfortable with the procedure. We know that this is injection methods. So this is lidocaine again. And And since we did infraorbital nerve block a while ago, we can also do the so-called mental nerve block there. So we can spray the pain freeze again. So when we do our marionette lifting, the goal is to be able to reach the marionette line here. So I'll be injecting here mental nerve block there, and then spread the lidocaine. In thread lifting, we want to, as much as possible, lessen the injection of our lidocaine to minimize any reactions to it, because some of our patients don't want to have too much of the lidocaine, because after the procedure there will be too much of swelling. Okay, so I'll glide this again towards the marionette line, and the goal also here is to have a better mandibular region, jawline definition, and lifting of the lower third of the face. Okay, so we have to cross that marionette line here when it comes to the marionette lifting. Okay. Out, and then we're going to cut the remaining strands here. So iris scissor, press onto the skin and cut. So it's very significant also to check on the skin, prevent some dimpling from coglifting, because sometimes there are like complications of denting or undulations on the skins or irregularity from the entry point. So make sure that the surface is so smooth and no denting or dimpling of that. So press on this one here, please. So now we also wanted to do a jaw lifting here. So as we age, some people will already notice presence of jaws, the sagginess of the jawline region. Now for that one, my entry point will be on the temple hairline here. Make a horizontal line from the tail of the brow towards the hairline. So this is our entry point. So this one helps in reducing or controlling any pain from the injections of our lidocaine. So again, my entry point will be this temple hairline region. And since I already have infraorbital and mental nerve block already, so I'm just gonna be numbing the entry point there. Okay, I'm using a gauge 19 poker needle. So make sure you really insert the tip of the bevel of the needle, and then we have spiral cog threads again here. For Ma'am Lovely, I can use 3 of my spiral. Out, and then we'll cut the remaining strands of threads. So we have done the right side lifting for mid face, lower face, and jaw lifting. So we'll proceed to the opposite side. we have done left and right using our PDO cog thread lifting. We'll show the result to Ma'am Lovely when CSA Medical Aesthetics return. And we're back, so we'll now show the result to Lovely. And here is our mirror showing the effect of our cog thread lifting on the mid-face, lower face, as well as a jowl lifting. Okay, Ma'am Lovely, you can check on what we have done. Okay, so I can hold the mirror for you and try to observe the nasolabial and the marionette. There's a reduction already, and the jowls are already lifted. Although, of course, initially, when we have done the procedure, expect some swelling because we have injected a lot of our lidocaine there, and we have multiple insertions of our cog threads. It was like 9 here and 9 on the other side. Okay, so temporary swelling and marks on the entry points. And usually, the swelling goes away in few days to a week. It's a case-to-case basis. Now, for Ma'am Lovely, so the goal is to restore the original position of those mid-face and lower face tissues to the higher areas of our face. So we have used our cog threads for the lifting benefit. And the good thing is these are also collagen stimulators. So, Ma'am Lovely, so how are you right now? So look at that. It's still a natural result, but this is not yet the final output because we still have wicks that it's still gonna take effect. As time passes by, it will still give you that benefit of lifting, skin tightening, and firming. For now, she feels kind of swollen because of the multiple shots of our lidocaine plus those long cog threads.
True.
So, Ma'am Lovely, few words.
Okay. So far, tolerable naman. Hindi na makamukha yung bibig ko kasi nga.
Yeah, because we know...
It's an effect talaga yun.
Because we did infraorbital nerve block plus mental nerve block. So, right now, she's still feeling those blockage of the sensation. Yung sensory nerve natin, medyo dinampen muna natin.
Some people doing like this, mayroon ba tayong hilamos after how many days?
Yan.
Or another one, para diretso.
Okay.
For the medicine that para
You will
sa
take
ng pamamaga or antibiotic. Because it's still one yan di ba?
Yeah.
Yun lang. Kasi marami akong
Exactly. Questions
tatanong.
they're asking, no? So, this one, we have done entry points here, okay? Now, since we have cleansed naman the face before we did the procedure, we advise our clients to do the facial washing the day after already.
Okay.
And no hot water temporarily, okay? As much as possible, just the water directly from the faucet because it's already cold. So, we will also do ice compress after this. Like a day to 24 hours to 48 hours, you will be doing ice or cold compress. And then after the procedure, we give you actually a list of what to do and not to do, home instructions, what food to avoid, and then we prescribe you with some of our oral analgesics and anti-inflammatory or anti-swelling medicine, plus the prophylaxis antibacterial because we did injections and insertions. So we have those medicines to be given to you as well. And then we'll follow the do's and don'ts that we're gonna give you later on. Okay, and then we usually advise our patients to come back after 2 weeks for a follow-up, and we will do a so-called symmetry check, balance check, because sometimes we have individuals with asymmetry of the face. So after 2 weeks, when there is no more swelling, we can already appreciate left and right side, and then we can correct any asymmetry or imbalance. Thank you so much, Lovely, for joining us again and for trusting CSA, of course.
Of course.
Okay, so we'll see her again in future episodes for continuing our maintenance of rejuvenation, skincare, and anti-aging treatments.
Okay.
Okay, thank you, Lovely. Thank you so much. If you have questions, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. We have our FB page, CSA Medical Aesthetics, and Instagram, CSA Medical Aesthetics. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.